Hey, everybody. I'm here with Ken Mensch, author of Every Baby Hurts. And I'm Lisa Zakoski with Good Story. And I'm so excited to share the book that Ken released. And we have just been on such a fun journey. And I know this book has been a long time coming for Ken. And so I'm so excited to just introduce him. And he's been helping people get out of pain just almost impossible stories, right, Ken, where people have been in pain for years and years and believing it was kind of their permanent state of life and on their last thread, on their last straw, and they've come to see you and have often, overnight, I would say overnight success, but in one visit, often people are walking out of your office in a complete state of being pain-free. And you were doing that with adults and athletes. And then now you had this kind of revelation about how this work that you've been doing to get people out of pain could help babies and then maybe even prevent, kind of this long shadow of pain over the course of someone's entire life. So for hopeful moms who are up at night with babies crying and feeling like I'm doing this all wrong, something is wrong, it shouldn't be this hard.
Right.
What did you discover, Ken, about babies being in pain, and where did this title, Every Baby Hurts, because that's pretty bold, where did that come from?
Um, yeah, that's uh you'll get a preview of part of the book. But it's essentially to be told. I'm a grandfather of seven grandkids and a father of four, and I can tell you I was sleep deprived for 2 years with each of my kids.
Yeah.
So, and I was getting maybe 2 to 3 hours of sleep. As a matter of fact, at one point I was working as an electrician on a construction site doing industrial electrical work. And I was standing up talking to my boss, and he was telling me what was going on, and my legs buckled, my eyes rolled back in my head. And I caught myself before I fell down because I literally fell asleep while I was standing up talking to my boss. And he said, "Dude, did you just fall asleep?" And I said, "Yes." And he said, "What's going on?" And I said, "I have a 2-month-old baby at home." And he said, "Dude, I get it. Just be careful around the heavy machinery." So, I know what this feels like. I know the frustration. We did everything that we thought would get, especially my oldest daughter, who now runs the back end of my business. God bless her. And
Yes.
and I just I it was look, what we're taught is feed the baby, burp the baby, change the diaper, and that's the list that we get. And if that doesn't work, throw them in the crib, not too hard, and turn the light off, and
Yeah.
close the door and just let them cry it out.
Right.
And it's like, those are the lucky babies because they don't get beaten. And that you really don't get much more than that. And they've already figured out that if you do that to a child, if you train them to that they feel abandoned, it causes major problems down the road. I just saw a podcast about this the other day. And so I know what the frustration is. Because I've lived it, and I really wish that I had known what I know now back when I had young children.
Yeah.
Um, and it's ironic because it was Lauren's 2 children that actually brought this to light to me. And I can't start this without giving credit where credit is due, and I do that in the book as well, just because I'm not taking credit for any of this. The technique that I developed over 30 years ago was an answer to a prayer to give me wisdom, knowledge, and discernment to figure out a better, faster way to help people get out of pain. And God has been very gracious in giving me insights. And I swear every time I figure something out, the angels in heaven are jumping up and down and say, "Oh, we got it again." Um, well, you should have given him a bigger brain, God. Anyway, um, my oldest daughter had uh, a child 13 years ago, Austin, her son, and um, he was screaming when he came out of the vaginal canal,
Yeah.
and he almost never stopped.
Oh,
And it was particularly bad when they changed his diaper. It sounded, instead of like a distress cry, it was like you're tearing flesh cry kind of thing. Just really like there was somebody was tearing his face off or something.
yeah.
And I didn't hear any of this until 3 weeks after he was born because I was in Austin and she was in Baton Rouge and business and all the other stuff in it. So I got there at 3 weeks and we discussed this because she changed his diaper all the time and this cry, we couldn't figure it out. Went to bed and woke up at 5 a.m. with this scream again. And I thought to myself, or God said, this is what, anyway, it was, I thought, well, they're pulling his legs out and uh, it's probably pulling on his hip flexors that had been tight against his body while he was in the womb. And I said, I think I can help him. And she like motioned here, take him. And I said, let's do it a little bit later in the morning. So about 11 o'clock, I put him in my lap with his legs towards me. And I put my left hand in his left hip flexor with the leg shortened a little bit. And he screamed like I was ripping his face off.
Oh,
Same cry that we'd heard before. So I, we did what we do and we'll discuss that later, what it is that we do. But we got that opened up and then nothing, no pain, no discomfort, no anything. He looked happy. And I said, well, I think that was it. Let's just do a once over and check him out and see what we find.
yeah.
And so I switched over to his left hip flexor and I didn't find anything. Like, there was no pain whatsoever, and I looked at her and I said, um, "That's weird," and she said, "No, Dad, it's not." Every sonogram showed that his left foot was right against his left ear or just
Wow.
having his knee pulled all the way to his chest, and so that one got shorter and the other one was down during the pregnancy. I said, "Huh, interesting." So, it created an imbalance in the hips.
Yeah.
And so then worked on his lower extremities. Those were kind of bad and got into his low back, and that was pretty bad. And then got to his neck, and that wasn't great either. But once we got done, he was literally just lying all the way back with his arms over his head, legs out straight in a neutral position, and just snoring. And he was completely comfortable in that position.
Oh,
And I thought, okay, that's interesting. And interesting in this way, we treat injuries all the time. You know, people have problems with their hips and their back and
right.
all that kind of stuff. But this was a 3-week-old baby, which I wasn't anticipating.
Right.
So then the real revelation came when her Lauren's daughter was born, Kala. She's now 11 years old. And so it's taken me that long to get this book out. Um, but she had nothing wrong with her. She was absolutely adorable. She was cute. She wasn't fussing. She was smiling. She was just adorable little baby. And I was there the day she was born. The day that day or the day after. I can't really remember. Anyway, because I did a lot of driving. It's like, oh. um, it's an 8-hour drive to Baton Rouge. So, um, anyway, we're at the hospital and Lauren looks at me and she goes, "So when are you gonna work on her?" And I said, I'm why would I work on her? She's fine. Yeah, yeah, okay, but when are you gonna work on her? And I said, "Sweetie, honestly, there's nothing wrong. I work on people who have issues, and she doesn't have any." And she said, "I get it, but when are you gonna work on her?" And I said, "Okay, I know how this goes. When do you want me to work on her?" Which it should have been the first question that I asked her.
Right.
And she said, "Tomorrow." And I said, "Alright, cool." And I thought it would be a giant nothing burger, and I could tell her I told you so and all of that, and so anyway, next day, she's 36 hours old, and still, she's not cried, she's adorable, and so I get her in my lap, and I put my left hand in her left hip flexor, and she screams like I'm ripping her face off. And I'm like, "What is this?" And so we got it worked out. I got into her right hip flexor. She screamed just as loud. And then worked on her lower extremities. Those weren't quite as bad, but then got into her low back. That was way worse than her hip flexors. And then
Yeah.
I got into her neck, and the neck was worse than all of it.
Yeah.
But
And
one of
pause right here for a second, Ken,
Yeah.
because I think this is an important point to make. On a normal muscle, like on an adult, if it's not tight and you push into it, it would be the same for a baby, right? So
Correct.
so
So
when you put the amount of pressure that you're applying isn't enough to hurt a baby, the body work itself isn't painful. It's when you get in on a tight muscle, just like any of us, if I push here, I'm not tight here, so it doesn't hurt me.
right.
Same
The
true for
the way
them, is
that
that right?
Yeah, the human body works this way. It was designed for pleasure, not for pain.
Yeah,
And we can get into all that, but the thing is, if you push into a muscle that's proper length, you can push through it to the bone with no pain. That's how it
yeah,
works. If the muscle's tight, it'll hurt. If it's really tight, it will really hurt. Now, the goal isn't to hurt somebody,
right.
and we'll get into a little bit of the nuts and bolts of what the therapy is. But and remind me to come back to the story again
Yeah, I
where
will.
we're at.
Yeah,
So, when you push into a muscle, when we push into a muscle, we're starting at the genesis of that muscle. So it usually is more toward the core and up the chain from like if your leg is a problem, we may start with your hip flexors because that's closer to the spinal column, and we get that switch turned off, and then work down the chain towards your feet.
yeah,
But so what we're doing, this is a combination of deep tissue, myofascial release, and trigger point therapy or ischemic pressure. So
sure.
when we push into a muscle, we're blocking blood supply to that muscle temporarily so it can't breathe, so it can't get oxygen, so it can't contract. Because if the muscle is just like if I put my hand over my nose and mouth and held it for long enough time, I'd pass out or was anybody else. So then your body goes limp, and then basically you could get moved any which way you want to. So when we
Yeah,
press onto a muscle, we're doing it with just enough pressure to block blood supply to that muscle temporarily so that it will just calm down and relax. When it does that, and then we start shortening it and then moving it slowly through the range of motion that it's supposed to go, what happens, it's like taking bunched up cellophane that's all in a ball, and it slowly starts to open. And so that's the muscle and the fascial sheath that holds the muscle shape. Once it gets back to its original position, the pain is literally gone. It's not gone a little bit, it's actually gone. Here's the
yeah,
reason why. Your body gives you pain to slow you down so you don't tear or break anything. It's a limiter switch. It's trying to keep you from hurting yourself. So everybody vilifies pain as though it's the problem, and that's why the entire medical community is built to treat symptoms of pain rather than treating the problem.
right.
Every time you get an injection, every time you take medication, every time you get a surgery, almost always what is happening is they're trying to kill the messenger. They're trying to turn the pain signal off, which is exactly the wrong move.
Right.
So if you lengthen the tissue and you open it from here to here, the pain literally is gone. So it turns like, think of a light switch. It just turns that switch off. Now the pain's gone here. So what you've
Yeah.
done is you've restored the range of motion of the muscle. You've increased blood supply and circulation and lymphatic drainage to and from whatever joint that's attached to, and the pain's gone. So if that's the first thing, then you move down the chain through the different muscle groups that were affected by this. And depending on the area of the body, there's a bunch of different things that you'd probably look at. Um, but that's the gist of how this works. It's very I just explained to you my entire method. Somebody asked me one time, Ken, they said, "Are you going to write a book?" And I said, "Well, it would be about 3 pages long." And they said, What are you talking about?" I said, "Well, which muscle are you going to push on, and then how are you going to move it, and then the pain's gone, the end." And I've discovered over the years it's a lot more complicated than that, and I figured that out when I was trying to train people to do this work.
Just a little bit.
So
Yeah,
it's
no, but I think it's good. I think it's really important to kind of describe to people to understand because, I mean, you could try to hurt, but when you were working on baby Kala and she seemed normal, she was asymptomatic, not crying, no tummy upset,
Mhm,
whatever.
nothing.
And so when you pushed on her, in a normal tissue, you would expect there to like
You
maybe
know,
be a reflex, but not crying,
yeah, I
right?
didn't think that I didn't anticipate any of that.
Yeah.
I was convinced that that was, not gonna happen. So,
Yeah. So,
Kala and
yeah, keep
Kala
going
ended
with
up Kala ended up in the same position that Austin was in. She was arms over her head to the sides, her legs completely stretched out and snore. And I I l this is critical. I looked at Lauren, I looked back at Kala, and I looked back at Lauren, and I said, "You know what? If that baby hurts, every baby hurts." And then I went, "Oh my gosh." Now, I'm gonna back up a second. At the beginning of my practice as a massage therapist, I prayed for wisdom, knowledge, and discernment to figure out a better, faster way to heal people and get their bodies back to full function.
yeah,
But an additional prayer uh, happened years later. I gotten done reading a compilation of religious writings by Leo Tolstoy. If you don't know anything about Leo, he is one of the most brilliant minds in history. You should pick this thing up. I'll have to get a copy
okay.
of it just so I can show people because it's just amazing. Um, and I got done with this and I put it down and I'm thinking to myself, man, this guy is brilliant. I am not. He is and he is such a great writer and he's only one of thousands and thousands and thousands of people who have written down probably everything that's ever been thought of. And I said, I'll bet that there's not an original thought left. And then it
Said
occurred
it
to me.
all.
I said, well, maybe everything hasn't been thought of. And I said, God, could I have at least one original thought before they throw dirt in my face where it will actually make a difference in this world? And when I said, "If that baby hurts, every baby hurts," I knew that that was at least one of the original thoughts that I would have, and I'm not closing it off that I may have more, but it's that was and it was like this flood of just information just pounding into my head about the ramifications of this. And the
Yeah,
very next thought in my head was the parent who's working 3 jobs. They've got 2 hours to sleep before they have to get up and get to their next job. And they put the baby down and they immediately start crying again. And that caregiver picks the baby up and just starts shaking it. And there's an organization out there called uh, shaken baby syndrome, and it's like
Right.
those 3 words should never be in the same sentence, and
Yeah.
but so many babies are shaken to death, or they're shaken till they have brain damage or something like that, and then the marriage falls apart because, "How could you do that to my baby?" And then the guy gets arrested, and all of these
Mm.
things because they're up to here with just
Sure.
not getting sleep.
Yeah.
And that was the very first thought, and I said, "Man, I gotta write a book." I went home, bought a brand new laptop, and started typing this thing 11 years ago. So
Wow.
and it's been eating at me every day since that this thing hasn't gotten out. So it's we'll talk more about all the different reasons why that this is so important, and it and I we have some people we talk to 'em about it, it's like, "Ah, my baby's fine. My baby's
Yeah.
fine." And I'm like, "Y let's talk some more about that." And part of like, one of the things that I've done a lot of study on this since, and one of the things that people have to know is that babies form more neural pathways in the first 2 years of life than they'll ever form. Their
Yeah.
brain is just going, and it is that forms the foundation for their intellect. So, then once that's formed, then their intellect grows up from that, right? Okay.
Yeah.
Now, those neural pathways are being formed while the baby's in constant pain. And let me describe the pain that we're talking about. Everybody that is watching this, remember the last time that you had the flu, and it was the worst day of the flu because you had body aches from your head to your feet, and it was just this constant ache. That's what babies are feeling. It is my belief that the because I thought about this. The last time I had the flu, I had horrible body aches and pains throughout my body. And being a massage therapist, I'm wondering why these things are so stinking sore.
Yeah.
And so I got a pen paper out because that's all we had back then. We didn't have anyway.
You didn't have your
I
phone.
got a stone and a chisel, and I anyway. And so I wrote down every muscle group that was sore on me that I could tell. And then when I got well, completely well, not feeling anything, no symptoms of the flu, I got that piece of paper out and I went through and I pushed on every single one of those muscles, and they were all still really sore. Now, what happens is, just like if you lie down on the floor, you're going to feel the floor against your back, but after a while, you forget about the pressure on your back because your body, it's not important anymore. It's not dangerous or anything like that. It's a self-preservation thing because if you felt all of the pain that you have all the time, you couldn't function. And that would be detrimental for survival itself if you were in the wild. If you were just overwhelmed with all of this information about all of this pain that you have. And my belief is that all of the aches and pains that you feel when you are sick like that are your pre-birth postural deficits, the muscles that have been tight and contracted since you were in your mother's womb. And your brain just blocks those things out until it's overwhelmed with some illness or sickness. And so those are things that you carry around with you for your entire life. Now,
Yeah.
why is that important? It's important in so many different ways, but uh, there was a study done by, and I forget which group, it was Harvard or somebody, and they followed ex NFL football players. And there were 2 groups, Group A, Group B. Group A had an ACL reconstruction surgery. Group B didn't. And so they tracked these people for decades. And what they found was that something that shocked them, the group that had the ACL surgeries had 53% more cardiac deaths than the group that had no surgery on their
Wow.
leg. and they're flummoxed by what caused that. Now, I'll fill in the gaps about my reasoning here. When you get hit in the leg you tear an ACL, what happens to all of the muscles in that lower extremity? They all contract.
Yeah.
All right. The fascial sheath that holds those muscles in that shape all contract as well. Then
Right.
when the swelling gets down, they'll put them in a brace, and then when the swelling goes down, they'll do an MRI, they'll determine the damage, and they'll say, "Okay, we have to do surgery, so we're gonna harvest the tendons from your knee or from your hamstrings," and then they cut in there, and they do all this stuff, and they put it back together, and then when you're done, you're gonna go to physical therapy, and they're gonna be trying to strengthen contracted muscles, which is impossible. So it aggravates the crap out of those things. It's never exactly the same because nobody opens up the tissue properly. And so that person, from the time they tore that ACL, now has a very difficult, their hearts have a very difficult time pushing blood down into that leg, which is it's a
Which is
big part of your circulatory system. And so it puts a huge amount of stress on the heart and every other organ system in your body. So if that causes just an ACL injury causes 53% more cardiac deaths than somebody who didn't have an ACL surgery, what are the ramifications for all of the muscles that are tight inside the womb to be tight and contracted for an entire lifetime?
yeah.
How much shorter are our lives and how much harder are our lives having to carry that tightness and restriction around? It's like it's like driving down the highway with one foot on the brake and one foot on the gas. And you're
But
moving as quickly as you can, but every one of those muscles is pulling on you your entire life. That affects all kinds of things. But
right.
let's get back to the neuro pathways.
Yeah.
If you eliminate all of the tightness in a child when they're days or weeks or even months old, their brains form differently
Interesting.
because you've eliminated the thing that they're focused on the most. The thing they're focused on the most isn't their job because they have none. It's they don't have an
Right.
agenda. They don't have chores to do. So they're focused on the one thing that is at the front of their brain. And
Yeah.
because of that, they're distracted, they're not paying attention, they're not listening to language, they're not seeing colors, they're not focusing on other things going on. One of the things that our parents notice immediately is the kid starts tracking them all over the room. And when somebody else comes in the room, they'll look over at them and they're listening to everything that's being said. And
Yeah.
so what happens to them is that instead of their foundation for their intellect being this big, now I'm holding my arms way out to the side. Now their foundation is this big and their intellect grows up from there.
Yeah.
And the truth is nobody knows what that looks like in a fully grown person. Nobody,
Yeah.
because nobody's ever experienced that. Now, I will say that that every parent whose child we've worked on has come back with the same stories. Doctors that delivered that baby are shocked at how old they are because of how far ahead of the curve they are on every metric in development. Whether it's physical, whether it's emotional, whether it's intellectual, they're doing things that other kids don't do.
Wow.
And it's a massive difference. It changes the outcomes of that child exponentially. And even
Yeah.
Kala, who experienced no, I mean, she didn't look like she was in pain, but she was in massive amount of pain just from touch assessment to show how much she was restricted and how much that would have eventually caused her issues.
Yeah. That's really incredible, Ken. And I don't know, for moms and dads out there who are listening and tracking with this, I'm sure there's a million thoughts racing through your head. Like when you and I first had this conversation, I immediately flashed back to all my experiences with babies and just having this feeling, and having a variety of experiences. I've 7 kids. So, every baby has been a little bit different, but, remembering my harder ones where it was just like, every time I set them down, they cried and then they're gassy. And so I'm giving, these gas drops thinking that's the
Mhm.
problem. I can fix it. Nothing was helping. They're crying. I am exhausted. Right. And I am a really pretty mellow, patient person. But when you haven't had sleep, you're a new mom, this child that now you have, you know, um, 24/7 care for, and you feel like you're supposed to know how to help them, and you
Right.
don't know how to help them. And, I think there there's so many feelings that I feel hopeful, like, this is an answer to problems that have just kind of been like, dot, 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 your baby's colicky. Well, what does that mean, and what do I do? And, how do we move on from there? So there's hope, like, for the future. Then there's this feeling of, "Oh my god, I wish I would have known that,"
Oh, yeah.
how much of our bonding experiences with our kids, how much of their own personal lives, how much of their identity, could be shaped differently if we could understand that this crying, that's, by the way, not just, babies cry when they're hungry, they cry when they're tired. Those we can
And
fix.
they're
But we're
wet.
this crying where, you know, nothing's really helping, or laying
Mhm.
them on their back is they're crying. And from what you're saying, babies they're crying like this because of pain. So, um, looking back on all that and thinking, gosh, if I would have thought differently about my baby being in pain versus, now they're fussy, now they're, bad sleepers, now they're, needy, or things like that,
Right.
where we just
Right.
come to these conclusions because we don't have any other answers,
Well,
because telling me that a baby is colic gives me no solution. And so moms are frustrated, tired, like you said, the shaken baby thing is an extreme reality. But even at its most conservative, we're disconnected from our kids. They're disconnected from us.
okay,
We're
think
not
about
having a good time.
think about the difference of your experience with your children. Had they had their bodies opened up,
Right.
the thing that happens immediately is that the mom immediately notices how soft their baby feels in their arms. They can turn their head fully both ways, which allows them to latch easier when they're being breastfed because they'll have a really hard time. And every time that if these muscles are too tight on one side and they're trying to turn this way to, then this tightens up and then it messes with their latch. And then
Yeah.
they'll start chewing your nipple off,
Yeah.
basically. And then that leads to its own issues.
Right.
And then if they're always fussy, do you wanna spend more time with them or less time with them? It's
Yeah. Right.
always less, and then you feel guilty about that because you're a mom and this is you're supposed to be bonding with this little bundle of joy,
Right.
and it's so frustrating, especially for the parents, but for the baby, if you put them in their crib and just let them cry it out, now they feel abandoned, they're lonely, they're in pain, and they're in the dark. And
Yeah.
it's like, what does that do? I just saw a podcast that said it actually alters that baby's personality
I believe
permanently.
that.
Their brain does not develop the way that it should. It literally, they've done studies where babies are exposed to constant pain or chronic pain throughout their childhood, and it literally rewires their brain incorrectly, the way that it shouldn't be. And
Wow.
so we just my most recent baby that I worked on was the son of one of the kids that I worked on when he was a very young baseball player. and now he's got kids. That's how long I've been doing this work.
Wow.
And the baby was always very gassy. He hardly slept. He had to be up every 2 hours. You know the drill. And so after the first session, the baby was much softer. He was easier to hold and all that type of thing. He still wasn't getting full night's sleep. After the second session, the dad called me up and he said he's been sleeping through the night. All but one night, he woke up once at 2 o'clock, got fed, and then went back to sleep for the rest of the night. All of his gas issues were gone. Now, the gas part of it and the gastrointestinal part is very easy to explain. Your
Yeah.
hip flexors, you have two different sets on each side. One attaches to the front of the hip, the other attaches to the lumbar spine. If those are short and tight and contracted, they're not only rotating the child's hips forward, but they're pulling the spine forward, cocking it forward, and rotating it one direction or the other, depending on which side is tighter. By doing that, they're compressing the nerves in their spine that control their intestines, their digestive system, their sexual reproductive organs, their urinary tract, their capacity to eliminate properly is all compromised because those nerves are being pinched and they're not getting the proper signal to where they're supposed to go. So
Wow.
all of that can be eliminated simply by taking the stress off of those areas. Now, I'll give you an example of an adult that's dealing with the pre-birth posture uh, in that regard. We've had females come in who have always had 20-day menstrual cycles. Okay, anybody listening that think that that's a great thing, if you've had a menstrual cycle, you're probably like, wait, every 20 days and not every 28? That's ridiculous. And
Yeah.
so, and they had such cramps and pain during a menstrual cycle that they had to miss work for a week. All right.
Yeah.
We've worked on uh, not a ton of these, but a few, probably a dozen or more, where we worked on them one time, got their hip flexors open up, got their spine sitting back where it's supposed to be, and their hips situated where they're supposed to be. They immediately went to 28-day cycles for the first time in their life, and they could
Wow.
handle their menstrual pain and cramps with a Midol. And
Yeah.
and just and we're able to go to work and not miss any time or anything else. So those things had been tight and contracted, and those nerves have been compressed since before they were born. And
It's
so
wild.
this is one of the issues that adults can have their entire life.
Yeah.
And
Right.
it's not just that. I worked on a 68-year-old man who's okay, now he was a year older than I am right now. Shocking. Anyway, he was tall, he was a businessman, really smart dude, but he was stooped at the waist. And he told me his mom had berated him from the time he could remember when he was a little kid about his posture. Your brother stands up straight. Why can't you just stand up straight? Just stand. And he said that she did that until her dying breath. Now think about the psychological distress that this man has had to deal with his entire life. And now he's walking into a board meeting with his competitors and he's basically bowing to them until they get to sit down. And he wiped him up at the table because he's really a good business guy and he could beat him that way. But he always had this issue. He only came to me because he fell and hurt his shoulder. And I looked on his intake form and it said that he slept on his right side 50% of the time and his left side 50% of the time. And so I knew he had his knees pulled up at night when he's sleeping because that was going to be more comfortable. And so I said, listen, what we're going to have to do is get you off of your shoulders. That's going to help this. And then we can fix your shoulder. So I got his hip. I said, I said, when we do that, we're going to get you standing up taller and you'll be able to take longer strides and this, and that. And he said, hold on there, Skippy, because I was young enough then that he would call me Skippy. And he said, you're telling me that in this session, you're going to get me to stand up straight? And I said, yes, sir. And he goes, well, how much time is that going to take? And I said, because I was thinking it was a money issue. And I said, 10 minutes, 15 maybe. And he looked at me, he said, you're serious? And I said, yes, yes, sir. And he started sobbing. 68-year-old, very distinguished businessman is sobbing on the table because I told him I was going to be able to get his hip flexors opened up and get him standing up straight. And he told me the story about his mom and stuff. And I said, well, it's still about 10 minutes. So you ready to get started? And he said, yes, please. And so I got his hip flexors opened up. I said, go ahead and stand up and see what you're feeling. He stood up straight for the first time in his life after 10, 15 minutes of work on his hip flexors. And I said, sir, there's a full length mirror down the hall. I said, I want you to go take a look at yourself. And when I followed him, he was standing at the mirror sobbing again because he'd never been able to stand up straight. And he was having to deal with decades and decades of this berating talk from his primary caregiver, the woman who loved him the most, cared about him the most, who just never, she blamed him for his physical problem. And it wasn't his issue. It was the fact
Yeah.
that nobody knew that just doing a simple procedure on his hip flexors would take care of the issue. So it was, and then we fixed the shoulder, and which nobody else had been able to do because they were trying to strengthen contracted muscles, which you can't do. So we got
Yeah.
the strengthen it, and I haven't had to see him again. He literally one session changed everything for this guy. But he went 68 years dealing with something that could have been taken care of in one session when he was an infant.
Yeah.
And oh, I forgot this detail. Tri-state track champion in Texas. And Texas, Oklahoma, Louisiana. He was a tri-state track champion. Now, let me ask you a question. If he'd have had his hips opened up when he was an infant, he might have made the Olympics
Yes.
because his stride length would have been way longer. He would have been able to pick his knees up much higher, and he would have been much faster. So this isn't just about the emotional aspect, but that's a huge, and it's not just the intellectual aspect because that's huge, but
Yeah.
physically, people will grow up bigger, stronger, and faster because they're not limited by pain telling them to slow down so they don't hurt themselves.
Right.
And so it's there's so many components to this that people have never ever thought of. It's
Yeah.
astonishing to me that this is the original thought that I had, which is crazy to me. Crazy town.
Yeah, well, I mean, I think it's just interesting, it is to when you really start to wrap your head around how much it can actually impact and all of the things that didn't have to happen for people.
Yeah.
It's almost just kind of blows your mind so much that it's a little paralyzing to go, I can't believe all of these things and that sweet man for 68 years dealing with physical pain, physical limitation, emotional trauma from his mom, and just, I mean, a life lived completely different, from the beginning. And so I think that's why I'm so excited about Every Baby Hurts is number one, for the symptomatic babies, the babies that, you know, we've misdiagnosed as just kind of normal. This is just what babies do. They
Yeah.
just cry and it's just a phase,
Yep.
and and I think a lot of moms everywhere are just deep down knowing, like, that can't be right,
Right,
something is going on with my
right.
baby, but I don't have an explanation. And I think the world is kind of just now really starting to understand fascia. And I know that maybe because maybe because of all of the content of yours that we've consumed, all of my feed is full of fascial releases and people releasing trauma and, their tongue and their face form and their posture and kind of this invisible piece that hasn't been detected on imaging because it can't. We're not seeing its impact on MRIs, on
Right.
CTs, on ultrasound. Um, and so, I mean, I'm a former ultrasound tech, and not just for moms and bellies, but people coming in for unexplained pain all the time, and they're not catching it on imaging. They're not catching it, on blood tests and things like that. They have no way to explain this pain. And these people are walking around in pain with no explanation. And I
I'll give
think,
you I'll give you a quick example of that.
yeah.
There's this is my newest least favorite diagnosis, sports hernia. Uh,
Oh,
a sports hernia is this: you have pain where a hernia would be, but they can't find it. So they will actually do exploratory surgery on somebody with a sports hernia to see if they can find something. Let
wow.
me explain what that is. It's tight contracted muscles and fascia that are pulling out attachments at the pubic area on either side, and it is almost always a groin, hip flexor, or a combination of those two things. And once you lengthen that tissue, their sports hernia disappears. It's gone. And so
Wow.
what can that person do? They can run higher, run faster, jump higher, and actually start to sniff some of their potential. And it's
Wow.
that one of the things that bothers me most, and I think is one of the greatest tragedies in life, is unmet potential. If you
Sure.
if you if you got a car and it was a Lamborghini or something like that, and it had a limiter switch on it, and you could only go 20 miles an hour, and you had
Yeah.
no idea the entire time you owned this thing that it could go 220 miles an hour, you'd be pretty pissed once you found that out, if you ever
Right.
did find it out. And it's like
Yeah.
unmet potential in anything is just wrong.
Yeah.
Usain Bolt has scoliosis. That's caused by one of the hip flexors being too tight and contracted, rotating the hip forward. When he went through a growth spurt, the spine pulled over, and then the other part of the upper spine compensated by curving also. And so he had one leg shorter than the other one. He was shorter than he was supposed to be. He'd probably been maybe an inch or two taller than he was, and he would have been faster out of the blocks. And so one of the greatest runners that's ever lived never reached his potential. And if
Incredible.
you think of a great athlete, you've never seen them at their full potential because they never got these things open up when they were babies.
Wow. That's so wild. And I keep repeating myself here, but it really is just kind of mind-boggling. And I think now that I kind of think the world is in a place of waking up where we're tired of covering up symptoms. We're tired of, you know, um, answers and having to jump through hoops and get our bodies cut open to solve all of these problems, when our bodies were really designed very intelligently. And I think we're just tapping the surface of, really what really what can happen when our bodies are functioning as they're supposed to, instead of covering up the very signals that are saying, "We need help.
Yeah.
Somebody pay attention to this muscle right here. Don't take all the meds and don't get it cut off. We just need to get some blood flow there and to get some lymphatic drain in the junk out, and you're going to be, reading Ken's 3-page book, how to get it fixed and back to, and this is really what I love most about you, Ken, is that, you really want to help people. And I think it's so rare. I know the majority of the medical community wants to help people, but we're limited by or are limited by the system that they are in. You know, you're trained to do this and to diagnose this, and some of the clinical skills in using, our designed purpose, understanding our design purpose and how to get it back is what's really exciting, that you want to help people. You don't want people coming to your office all the time. Your goal is to get them in and fixed, and hopefully you see them again at, a soccer
A
game rather than
barbecue or
in your
something.
office. Yeah, exactly. And
Yeah.
so I think this is just such a great starting point for moms and, and parents and grandparents, and just beginning to see their baby differently. If they're not in a place yet where they can get to your office, and one of your offices in Austin, Texas, even just beginning to think differently and say, okay, this baby's crying because they're hurting. That's a huge step, because
Right.
now we've called it something and now we're understanding
Right.
what's happening versus, we can approach it with compassion, and rather than frustration, and rather than, you know, addressing, behavioral issues, or, my
Right.
baby's stubborn or
I
ornery
had
or bratty or whatever.
I had somebody ask me recently what was the goal for the book,
Yeah.
and the goal was to shine a light on something that nobody had paid attention to before,
Yeah.
to to begin to actually cause people to have empathy for that child rather than
Yeah.
frustration or
Yeah.
anger. Because once you realize the baby is crying because they're in pain, it shifts everything around. I mean, you're not
Yeah.
going to get mad at a baby that has a broken leg and it's crying all the time. But if they're
Right.
just crying, it's like when we were kids, it's like if you weren't bleeding out and you didn't have a limb that was offset like 3 inches, then you were fine. Just get on with
Back
it, kid.
outside.
Go rub some dirt on it. But but that was the mentality, and so when you see a baby that looks perfectly formed and there's doesn't seem to be anything wrong, then and you've done everything that the medical profession says to do, and
Yeah.
you're still not getting any sleep and the baby isn't thriving, you start to blame the victim, the baby, who is literally crying out in pain. And so if nothing else, this is a first step to get people to empathize with that child and start seeking out help so that they can find somebody to get these issues opened up. Now,
Yeah.
I had another conversation like this earlier today, and they asked me, said, "So you have 4 locations in the Austin area, but what if somebody lives in Alaska? And what if somebody lives in Spain? And what if somebody lives in the Congo?" And I said, "Okay, trust me. Trying to grow a business without any business classes, by the way, is frustrating because you're how to scale and all that type of thing and how to get more of a reach because we've been having people call us for 3 decades, and the phone call goes like this: "Is this Ken Mensch?" "Yes." Okay, so let me ask you a question. Is there anybody anywhere close to me that does anything close to what you do? And for the
Right.
longest time, the answer was no, because I didn't know of any. And there are a few groups that do something similar, but I've worked on thousands of patients who've been seen by these other places. And then they're like, Ken, nobody's doing this like you do. And this is insane how thorough you are and how quickly you're getting through the body and how much relief I've gotten from this one session. This is insane. You need to be everywhere. Are you going to open a place in Seattle? Are you going to open a place in Florida? Are you going to open a place in Spain? Are you going to open a place? And it's so it's been frustrating because there are people. Look, I've gone on vacation in different places, and we've been to France and England, and every place you go, No matter if it's this country or any other country, you see people walking around in pain. You see them
Yeah.
all over the place. They're limping, they're walking very slowly, they're stooped at the waist, and you can't just stop people, tap them on the shoulder, and say, "Hey, lie down, let me fix you." Um, and and so the answer to her question was this. Um, we've been all in trying to get this book done, as you know, Lisa, and we're trying to promote it and get it out there so people can get a hold of it so that we can stop the abuse of these poor little kids that are screaming all the time. The next step is we're going to start with clinical trials with infants with the company called Owlet, and they have a sock that they you put on a baby that has
Yeah.
sensors on it, and it tells respiration and heart rate and sleep patterns and all of those things. So we'll have them do the we'll have them tested for a week or two before we work on the baby, and then we'll monitor them afterwards for several months, and then be able to collect empirical data to show how that this stuff works with all of the different babies. Now, while we're doing that, one of the caveats will be that we'll film the sessions, and we're going to use the video from those sessions to create training programs to teach practitioners all over the world how to do this technique on babies no matter where they are. And that is the very next step in our mission, is to be able to train people online and to show them exactly how to do these things with measurable pressure and all that type of thing, so that they're using the proper amount of pressure and that type of thing. Um, and then we'll obviously be able to have some long-term things where people come in for touch assessments, and we'll do in-person seminars and that type of thing as well. But then my dog's barking because she wants attention.
That's
Daisy
okay.
Daisy does not like
They
being
work
left
on
alone.
dogs too, right? I
Yes,
mean, people we
yes.
haven't mentioned that, but yeah.
As a matter of fact, I don't know if you can see, I've got bandages here.
Yes.
Mm. We have a mama dog that we're fostering. We're up over, gosh, we're close to 170 dogs in 6 or 7 years,
Wow.
fostering dogs, and one of them is, I'm gonna have to get the dog. Hold on one
Yeah,
second.
that's okay,
You
that's
okay?
okay.
Daisy, come. See, good. Oh, she's that's right. Yeah. Okay. This Daisy.
There's your baby.
I'm the only
She's
person
a
in the family that can hold this dog because she bites everywhere else.
aw, you're
Anyway,
her person.
the mama dog, uh, she'd bitten Libby already, my wife, and so I picked her up. I had gloves on, the coat, and I thought I was gonna take care of this thing, and so I picked it up and I brought it outside. I'm sitting in the chair, and she when she felt a little better, and I was just petting her and stuff, I thought I was safe, so I took the gloves off, and as soon as she felt like she had a window to get away, she just clamped on my arm and just bit it, and then this arm got swelled up twice the size, got infected, all kinds of issues. Anyway,
Oh my
one of the
gosh.
puppies, one of the 6 puppies that we have, Bergen, Libby's daughter, noticed that one of them, her back legs and her tail weren't working. She was pulling herself around with her front legs.
Oh my gosh.
And so I went, well, her hip flexors are tight. Let's get them opened up. So this little puppy is 2 weeks old, and it's probably, the size of my hand. And so I got it turned upside down, and the puppy's just sitting there. And I got my hand in her left iliacus, and opened it up, and she's like, "Oh," and so that's indicates that now there's only a 2-week-old puppy who had pre-birth postural deficits. Every puppy has pre-birth postural deficits as well, which leads to hip dysplasia and all kinds of issues with dogs.
Wow.
And then the other leg, the other muscle, the psoas muscle, was extremely tight. And she's again, "Woo, woo, 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 woo." We got this on video, and then later, almost immediately, her legs started moving, her tail was wagging, and she's now walking around, not quite as much as the other ones because we probably I need to do another session on her, but she's walking around, her tail's working, and that was just after when she was 2 weeks old. Now we're gonna
Wow.
videotape all 5 of the others because I guarantee you that we're gonna find the same issues with them even though they're asymptomatic like Calla was. And
Yeah.
so and we've done
Interesting.
this with adult dogs and with other puppies, and the results are insane. I mean, it's crazy. Just one example, we had a white lab that was bred by the Queen's breeders in London, pure
Oh.
white, pure white lab, and the dog was 8 years old and getting kind of grumpy. They had a 6-month-old puppy, and she'd snap at the other one because she didn't want to be left alone. And I said, "Listen, the next time that you come in, please bring the puppy in. I want to just check something." And so I worked on the dog the next time they came in, and then he'd brought the puppy, and I we got her turned over, and I got in her left hip flexor, which was the same issue with the other dog. And that dog, there was so much pain from that hip being tight and contracted that she wet herself. I
Oh
mean,
my
she was yelping and all this other stuff. We got it completely worked out. We worked on the other side. We checked the front shoulders as well and her neck. Nothing was nearly as tight as that left hip flexor. Now here's the rest of the story, like Paul Harvey used to say. These are hunting dogs. Okay. So when the puppy was about 2 years old, the guy brought these dogs in again to get them worked on, just as a tune up. And by the way, the older dog stopped and started actually playing with the younger dog because it felt so much better after we got her hips
Well,
opened up. Um, Labradors are not known for being like extremely fast or quick or in a hurry to do anything. They'll go fetch the bird and bring it back, but they're not in a big hurry, and they don't like move really quickly. And anyway, he said, "Ken," he says, "it's astonishing. You should see this dog hunt." He said it does this 85 to 90% of the hunt. He's going zoom, 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 the whole time. He said he's never once seen a Labrador that fast or go that hard for that long. And I said, "If you could please get a drone up and do an aerial footage of that dog doing that so that we can send it back to the breeder and show him what could be done with these dogs." So one of the things that labs are known for is having really bad hip dysplasia as they get older, and it's one of the things that actually brings them down. They're gonna get put down early, or they're gonna have to have a hip surgery or something like that, which is all just treating symptoms. If you could get a breed like a golden retriever or a Labrador retriever or a Great Dane or something like that, these dogs are all very prone to hip dysplasia. If you can get rid of those issues when they're puppies, they would live far longer and have far fewer medical issues their entire life. Now, that's
wow.
going to cost the veterinary community some money because you're fixing problems before they ever form. And
Yeah.
and for babies, if you get their hips balanced when they're a baby, they're way less likely to have scoliosis. They're way less likely to have low back pain, headaches, migraines, menstrual problems, all of these different things that people think are just normal. It's just normal when you get older. It's just
Yeah,
normal to feel this way. The
right.
same thing they're saying about babies. Well, this is normal behavior. And so as people start to age and they get more decrepit and they start bending forward, bending forward, well, that's normal. That's a normal part of aging. The dimension, all these different things, normal things. Well, if your muscles are tight and contracted, then they're restricting blood supply to and from your brain. Guess what? That affects your vision, your sense of smell, taste, balance, hearing, and cognition.
Yep,
And it can just be from decreased blood supply to and from your head. And if you're sleeping your entire life on your sides and that causes frozen shoulder. That's the primary issue with frozen shoulder. And it causes low back pain, sciatic nerve pain, all of these different things. These are all multi-billion-dollar industries throughout the entire medical community
right.
that would basically be eliminated.
Yeah,
People would be much happier. I actually took this book, I uploaded the entire thing to ChatGPT, and I said, apply a 5-generation butterfly effect if Mensch method was done on every baby born on the planet. 5 generations. It was basically world peace. I'm not exaggerating. It was people were much kinder, they were much smarter, they were problem
I
solvers,
believe
they
that.
were critical thinkers. They integrated with the community in a much deeper and better way than they ever would have. It's 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 when you get into the weeds of how much this could change humanity,
Yeah,
it's mind-blowing when you
yeah,
consider the options, and I've said in the book once or twice, the child, development, field is in its infancy because
yeah,
they've never considered pre-birth postural deficits.
yeah. Yeah, it's definitely some exciting times, but you're right, it won't be for everybody who depend on, um, pain, who depend on pain and dysfunction, you know,
Yeah.
and and, like I said, I really believe that most people are in the medical field to help people, but, sometimes systems are set up to keep people dependent
Mhm.
on, and so getting them actually better isn't great news for everybody, but
Right.
for those who have ears to hear and who this message really kind of people go, "Yeah, that makes sense," which I know so many people hear you even when you're talking about the adult body, the dog body. If you have muscles and if you have fascia, it can pretty much apply to that organism. But most people say, "Yeah, that makes sense." So I'm so excited for this book. It's coming out April 21st. And if you are in the Austin area and you can get to one of Ken's offices, his website is menchmethodbodywork.com. It's Moench is Mensch. And and I'm just so excited for this book. If you go to Ken's website, you can get the introduction for free and read that. And I think it's even beyond our conversation today. People will really start to wake up to what's going on and kind of the solution that you've developed, not just in adults, dogs, kids, athletes, but now babies who you're treating. You've been treating for several years now, so if you can get to Ken's office with your babes, go and get Ken's book. Again, April 21st, it's coming out, and we'll talk to you guys soon, but thank you again for joining us, Ken, and let's go. We're so excited for this book to be released.
Thank you, Lisa. I appreciate your time. I really do.
All
Thanks
right.
so
Yep,
much.
we'll talk soon.
Look it up.
Bye-bye.
Bye.